ready.
Yep.
Yep. Welcome, everyone, to another episode of The Doctors Are In. We are super excited to be able to have this opportunity to serve you in our community. And remember that we are all learners. We are all doctors. At least I believe we're all doctors. So we are here to assist you and also to learn from you. You know, all of you have something valuable that you can share with us. And hopefully, we also have something valuable to share with you. In any case, I open up the floor to any questions that anyone may have. And so we've
I
got,
have, uh,
go ahead.
this is Lowell. I have a question about the suppositories for prostate cancer.
Okay.
Found on those a little bit and which ones you recommend?
All righty. So the one that I would recommend for prostate issues is called endo something. And it's by Remedy Link. And we recommend that one in particular is because it will address specifically hormonal imbalances. And particularly the estrogen imbalance, a lot of times that happens when you're dealing with prostate issues. Because what many people don't realize is that as men get older, there's a tendency for them to engage in a process called aromatization, where they're starting to convert their testosterone into estrogen. And also, they start to activate the more inflammatory testosterones, you know? So this particular suppository will help to address that. And it's based in different herbs and things of that nature. And of course, the beautiful thing about the suppository is that if you recognize, or should I say, if you remember your anatomy and you insert that suppository, you're going right there next to the prostate, you know? And so you have that absorption into the rectum and into the bloodstream and going directly into that area. So it tends to be more effective than simply taking something orally and hoping that it'll get down to that area.
We'll eventually get there. Yeah. Oh, it just
Hmm.
seems to make so much sense.
Yeah, much more direct,
Yeah.
you know. And that's why a lot of times also one of the things that we suggest is for people to do colon hydrotherapy, because colon hydrotherapy will remove a lot of the waste that is impacting the colon. But again, if you recognize your anatomy, you have your colon, and then you have the sigmoid colon, right? That's going down and then to the rectum. And a lot of times people will have a lot of crap, literally, that stays in that area. And what they don't remember is that your body, if you're not releasing it, then your body's reabsorbing it into your system. And
Right.
so a lot of times when I have worked with people, and in the past, I used to do colon hydrotherapy sessions. And what they would recognize is once they did a colon hydrotherapy session, it was just so much of a relief and also a lot of improvements in a lot of different areas, because now you don't have that auto intoxication where you're basically reabsorbing all of the toxicity that your body's trying to remove. And this is very key because one of the things that the body's trying to remove is excess hormones, or hormones that no longer serve the body beneficially. And this will happen also with women. A lot of times when we have women who have hormonal imbalances, it's very important to look at the detoxification pathways, because what I have found is that a lot of women have hormonal imbalances because of that backing up of the hormones, where they're recirculating the hormones and they're not releasing it from the body. And so that is due a lot of times to a sluggish liver and gallbladder, where they're not releasing the bile and they're not releasing the excess hormones. And so that creates an imbalance in the hormonal system. And so then they'll look and say, oh, well, you know, I have too many estrogens, or should I say my estrogen level is too high and then my progesterone is too low. But it's not so much that the progesterone is too low, so much as it is that the estrogen is too high. And so relatively speaking, you have that imbalance in the ratio of estrogen to progesterone, and that creates all kinds of havoc. And skin issues.
Yeah,
Yes, so
Dr.
same thing.
Yeah, that I'm sorry to interrupt. Yeah, so I guess when you said when it goes back in the system, that can be something, right? The skin issues, right?
Mhm, mhm. Exactly. A lot of times when you see people who have skin issues, it's because their body isn't clearing it out properly. And so, even when we do a cleanse, a lot of times people will say to me, "Oh, Michelle, I'm breaking out." I'm like, "Yes!" And they're like, "What? What's wrong with you? I'm telling you that I'm breaking out like crazy, and you're like doing a hula dance." And I'm like, "Yeah, don't you prefer for that stuff to get out of you?" you know? And so when that's what happens a lot of times when you start doing a cleansing program, you'll start to see all of these skin eruptions. And that's because your body's like, yes, get this stuff out as soon as possible, as quickly as possible. So that's one aspect. Your body's trying to clear out all of these toxins. But the other part of it is that there may be a hormonal imbalance, like I said. And so a hormonal imbalance sometimes will lead to the symptomology of having all of these skin eruptions. So I was just talking to a young man, or his family actually, and we were talking about the fact that in this country, a lot of our teenagers, as they go through puberty, will have all of this acne. And I said, that is not normal, because they're like, oh, it's just, what happens when people have puberty. It's like, no, I've been to other countries where you have teenagers going through puberty and they're not popping up with zits and all that and craters. It's a lot of what's happening in this country with an excessive hormonal intake from meats and things of that nature that that create the hormonal imbalance. And then when you slap into their puberty where you're having a hormonal surge, now you're taking it up, 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 right? And plus you slap in all the crappy foods that we eat with all the different fats. And so that is what's leading to the eruption, of with our children, our teenagers. So lots of things to consider.
Yeah, Dr. That was me when I was a teen. Oh my gosh. It was like face, my back, and coming,
Mhm.
but you know what it was? Because as a West Indian child, I used to eat a lot of fruits, vegetables. I had access to a lot of those natural things. But then once I came here, I'm drinking the Kool-Aid. Oh my gosh, like things that the strawberry quick, all of those things that I wasn't used to. Yes, Dr. M. So
Yeah.
my skin, and it was so embarrassing for me as a teen. And I
Uh,
used to say, is this, but I remember that my skin wasn't like that. But I was saying, what happened? And thank God, Dr. M, when I went to South Shore High School in Brooklyn, you probably know, and I had Miss Porras was one of my teachers, taught me
of
about
course.
health. Miss Porras, Porris. Yes, I was just looking through my yearbook the other day. We took a health class and she taught us about the importance of, like, she said, if you take chicken, take off the skin of the chicken, that's like 50% fat. One of our professors taught us about with the pork, sometimes if you have to have it like at a certain type of heat, and you still won't get rid of the, so it was just so much. And once I was educated on that, that's when my skin improved a little bit. And then when I got into juicing, that's when everything, the cleansing, and it went in like a matter of 3 months, Dr. Michelle, this was my early 20s. I was like, wow, it was the gut. I needed to
Yeah.
clean the gut. Thank
And
you,
I want
Dr.
to
M, for
make
letting me share
one,
that.
I want to make one interjection with regards to the chicken and the fat. It's not the fat itself so much as it is the
Yes.
fact that we pump our chickens with so much hormones.
Right. Yes,
So
yes, yes, yes.
and see, it's the beautiful thing is
True.
that now I have a little farm and I have my little chickens, and
Mm.
my little chickens are so small and they're taking like forever to grow in comparison to other people because other people are feeding their chickens with all kinds of medicated feed and all of this grain feed and all that kind of stuff, whereas I have my chickens, they go out and they eat in the grass and all that kind of good stuff. And so their bodies don't, number one, they don't have the same amount of fat on them. That's
Right.
first and foremost. And secondly, I'm not concerned about eating that fat because that fat is
Right.
actually okay. And that fat will
Mhm.
actually help with your body's ability to better metabolize and utilize the protein,
Mm.
interestingly enough. But
Okay.
if you're eating ordinary chickens that are coming
Yes.
from ordinary farms where they're packed and medicated and over hormonized, then it's a concern because the chickens in this country, what they call the breed, what they call them, there's a certain breed of chickens that they use for meat in this country. And these chickens, they literally grow up in like 5 weeks and they get so huge that they start their legs start to break
Oh
because they get
no.
so they're getting so
That's
big
what I'm
so
thinking about
quickly
chickens.
that they don't
Yeah.
have the ability to sustain themselves, but they have them crammed into these cages where they kind of like hold up each other because they're so crammed in. And it's with the understanding that they're going to grow up within 5 weeks and they're going to kill them within 5 weeks. And if you've ever grown up in the country, chickens take a little bit longer than that to grow up
Right.
under normal
Right.
circumstances. But these are specific chickens that they have that are bred to grow up within 5 weeks because they're pumping them with all of this wacko feed to make them blow up so quickly.
And Dr. M, that you state that two things. When we see our children eat those kind of chickens, you have your little girls at
There,
13 looking like
yes.
20, or maybe could be overweight. And another thing, it's funny you mentioned that, Dr. M, with the chickens. One day we were coming from, we were in Virginia. We had just left Virginia and we passed a Tyson truck. I have it on recording. They showed you all the chickens crammed up. I was like, it broke my heart, and I'm saying to myself, how long was that trip that they have these chickens caged up like that?
And see, it's not just about the trip. It's about
Right.
how they're being
Yes,
raised. That's
raised
they're
that
they're
too.
being raised
Yeah.
like that. And see, you have to recognize that when you have all of those chicken crammed into that area, that is why they're flooding them with antibiotics because they can't afford for anything to erupt because it'll knock out the entire flock. So the feed
Right. Wow.
itself is medicated. The feed itself has all kinds of hormones, and the feed is grains, which is going to translate into higher levels of omega-6 in terms of those people who consume that particular type of chicken.
Mm-hmm.
Lowell, you were going to say something, Lowell?
Oh, I just say they're not happy chickens. So what they do is
Oh no.
they pull their
Yeah.
beaks off because if they have beaks,
Oh,
they start attacking each other because they're just
oh,
pissed off and unhappy. So
Yeah, and
it's,
that's sick.
you
That's
talk
yeah.
about
raising up the
hormones screwed up.
cortisol.
Yes,
Yeah, it's going to
yes.
raise the cortisol
Oh
in the
gosh,
meats.
that's
Yeah,
torture.
it's torture, but also, like I said, remember that that's what you're consuming. And so for me,
Yeah.
I look at it as not only are you consuming the physical imbalances of the hormones and the medications and the antibiotics and the cortisol and all of that stuff, but you're also consuming the energetics of that animal.
Yes. Yes. So the anger, right. Yeah.
Anger,
What,
the
like
the
Lo was saying, the
fear,
fighting. Yes.
the fear,
And
all of
that's
that
why we
stuff.
see all of this now, food and behavior, right, Dr. M? That
Yeah.
book with Barbara Reed Stitt. Yes.
And then with our
Wow.
young, especially our young girls, now they're
Yep.
starting to enter into puberty at much younger ages, like 8, 9, 10, when
Yes.
traditionally we would not have our first cycle until around 13. And
Right.
this is also being correlated with higher rates of breast
Mm-hmm.
cancer, higher rates
Yep.
of endometrial cancer, higher rates of PCOS, all of those things, because you're starting the process too early.
Yes.
And if you're starting
Oh,
that process,
gosh.
it's a hormonal imbalance for life. And then the other thing is that you recognize that estrogen is a proliferative hormone, meaning it helps things to duplicate and replicate, right? And so
Mm-hmm.
now, and it loves fat cells. And so what
Mm-hmm.
happens is that children start to create more fat cells during those growth surges. And the thing is that fat cells do not die. Okay. So once you create those fat cells, they don't go away. So it becomes even more challenging if you have a lot more fat cells. So even when you lose the weight, you would still
they're
retain
there.
those fat cells. And so those fat cells are always there saying, feed me, feed me, feed me. So
Right.
again,
The processed foods,
well, it's just everything. So the
everything,
key
right?
is to make sure that your children do not get fat. Because when I talk to people, I always ask them, were you a fat child? Because
Right.
if you were a fat child, it's different than somebody who was not fat when they were a child.
Right, right.
It is much easier to keep the weight off when you lose weight if you were not a fat child, because you have less fat cells, right? But if you have more fat cells and you get to be an older person, even when you lose the weight, those cells are still there. And it's more likely that they're going to get bigger again than it is for somebody who has less fat cells.
Yeah, wow.
So that's
sharing.
why it's so critical what RFK is doing right now in terms of putting the spotlight on what's happening to our children. We are
Yes.
basically condemning our children to a life of disease because we are starting this whole horrible pattern from when they're very young, you know?
And Dr. M, I want to add something to that. Speaking about Children's Health Defense, I'm going to probably share it with you and you can share it. I was looking at today, I just happened to go into, like, I think it was a Defender, and it says, I just took a screenshot, so I'll read it later. It says 1 in 3, kids, has a chronic health condition that will follow them to adulthood, just like what you were saying. That's too much. 1 in 3, not
and
1 in
all
10.
what we're finding is all of the chronic illnesses that we used to associate with adults are now becoming younger and younger. So the big one that I keep on making parents aware of is diabetes. You know, it used to be type 2 diabetes was called adult onset diabetes. Now they don't call it that anymore. They just call it type 2 because the fastest growing population of diabetics is actually our children.
Yes.
And when we went on tour with our nonprofit, It Takes a Village, we actually had programs for teens, and we would actually test the teenagers. And we would, everywhere we went, we would find teenagers that had blood glucose levels that were like in the 200s.
Wow.
And we would say to these children, you need to go home and tell your mom to take you to the doctor because this is not good. But that you would, they didn't know. They didn't know. And that's even for adults, you know, that's why I don't take it for granted. And I tested all of my children. And if my children had higher levels of their A1C, they were like at one of them was like at 5.7. And when I showed them that result, they're like, oh my God, because they know what I do and they know I talk to them all the time. And so they started to self-correct. So they started to stop eating the junk food and the soda and whatever, because they're like, oh my God, we don't want to become diabetic, because they're not going to fight me when they see that number from the lab. But how many people, how many parents you know are taking their child to the doctor and their doctor is doing any kind of blood work that's testing their A1C, their fasting insulin, and their fasting blood glucose? They're not testing that.
Yeah.
They won't do it. The hospital won't let them do it.
They won't do it.
We have no reason to run those tests on you.
Yeah.
Wow.
And so, you know, that's the travesty that this is going on silently. The same thing with hypertension. More and more children have hypertension. Crazy. More and more children with cancers, colorectal cancer, and things of that nature. Crazy.
Breast cancer.
Breast cancer.
Young women with breast cancer. Yep.
It is crazy. It's getting younger and younger and younger.
Yes, yes. Dr. Emmy, you're right, because I remember when I was in foster care before my son was born, a little girl, that she was one of 3 siblings, and she had diabetes at 10 years old.
Yep.
Yeah. And
How
I've
did they
never
find
heard of
out?
that.
How did they find
The
out?
foster care, I believe that the foster mom took her for testing during one of the checkups. She used to come, so I think that's how they found out.
But why? What was it that triggered them to test her?
Oh, I actually came in the case, but I don't know if it was just I don't know if it was her behavior, she was tired or maybe, because the parents had a history of they were you know, they had addictions, but I think it was the mother might have had it, and they tested her based on mom. Yeah, and I forgot exactly. I'm sorry, it was so long ago. Like this was like
Yeah. But
2009.
that is how I got my daughter, because I was a
Yeah.
foster parent, a medical therapeutic foster
Hmm.
parent, and they initially brought her to me as a respite provider because the person that
Hmm.
she was with wasn't getting any sleep. And so they're like, hey,
Oh,
Michelle, can you
wow.
take her for just a respite for like a week? So I said,
Yeah,
sure.
yeah.
And while she was with me, I noticed that she was like drinking a whole lot of water. It's like water, 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 water,
Oh,
water.
wow.
And she wanted candy and stuff like that. I was like, you ain't getting none of that stuff up in my house. And
Right?
so what I told her caseworker, I said, I'm seeing signs of diabetes. I think you should check her. They
Mm,
didn't they didn't listen to Michelle, not one iota.
wow.
And then about 2 months later, they took her in because she had to get her kidneys tested because she only has one kidney from
Oh,
childbirth.
wow. Oh,
And when they
wow.
took her in, they found out that her blood glucose was like over 400. And so that's when they found out that she was diabetic.
400.
And then they put her into my care because I
No,
was a therapeutic medical foster
Jesus.
parent. But, all of these
Oh,
things are going unnoticed
yes.
and not being dealt with. Hey, it's Dr.
Right.
Lewis. He finally made
Dr.
it. Oh,
Lewis is
A
in the
little late, but
house.
here. A little late,
Hi,
but here.
Dr.
Hi,
Lewis. I
everybody.
was late too.
Hi, Lowell.
Hi, I hear your
Oh,
new nickname is Crash Lewis, huh?
I can, if you want to see
wait,
it.
what's going on there? What's
oh
going
my
on there with Dr.
God.
Lewis?
Unbelievable.
He
Wait, what
had a bicycle
happened?
crash.
Oh, Dr. Lewis, I'm sorry.
Don't be sorry. I've been blessed. That sport's been so good to me. I've ridden 300,000 miles. I've crashed 20
Wow.
times. The first time I've ever
Biking.
broke a bone.
Oh,
He broke his
What did
sending
collarbone.
you break?
virtual
No, I
hugs.
didn't. I broke my
Oh,
skull.
Sternum.
that
That
sounds
is too
That was a
painful.
hard.
clear.
That's not going to break.
Actually,
No.
I
Oh,
landed on my head and there was no damage whatsoever. Then I bounced onto my shoulder.
that's that strong brain, Dr. Lewis.
No, he
It's
actually
called a
put a dent in the
rubberized
ground.
brain.
Oh,
Rubberized brain, full of amyloid.
Now Maura had a question for you
oh,
about the OCT, right? Do you have that question, Maura?
nice.
Yeah, no, I
Mo-
was kind
mo-
of I mean the OCTs, like I've had about 30 of them, but you know what it is, they're not they they're very inconsistent. Like I mean, to the point that they've missed kind of gross damage. And I was kind of curious, what's the take on them because it kind of you look at somebody who has like overt retinal symptoms, and the practice with a lot of practitioners is they treat the OCT, and then so my question about the OCT, so it's tomography. So what's the difference between an OCT and a CAT scan? Because that's tomography as well. And
well,
then
a
if you
CAT scan is an X-ray, whereas the OCT is using light, like MRI uses light, sort of I don't even know what wavelength it is, but it might be in the microwave region. OCT uses visible light. It's more about the skill of the interpretation. I mean, they're looking at normative databases and looking at the thickness and volume. But see, at the end of the day, more the best thing to do is lab testing because pathology always follows physiological changes. And so if you have retinal issues and retinal decay, it will usually show up. It's a systemic thing anyway. It's not just the eye. The eye is just a place where you get the signal, strong signal. Does that make
Yeah,
sense?
it does, yeah. But I think that if you, I mean, kind of take it start to finish, the eye is uh, it's the entry. Like that's the brain injury, and they're not treating it as a brain injury. So you've somebody who's got retinal
No.
stroke or macular stroke, but they're not treating it or even making any effort to acknowledge the fact that it is actually a brain injury and it is a serious one, like very, very serious one.
They're just not trained that way. They're looking at it as the eye in isolation from the rest of the body. I have a book on my shelf right back there, John Dowling, called the Retina, the approachable part of the brain. And there are very few people that do this only in research. And it's all, I sent my team, Nick, get up. You're up. I sent my team this I didn't send it to Michelle. She's not part of that inner team. Just kidding, Michelle. I sent it to Matt Pearson because he's in the insurance business, and this basically thing says, Doc, can you see the problem? And the doc is looking at the insurance man, and he says, Yeah, I see it. I see it in living color. Okay, so like, there's no coding for that more, and if you don't have a code, you don't get paid, and if you don't get paid,
Yeah.
You don't
you don't
see
have a
it.
practice.
But you know what it is? The newest model now in like I mean you used to go, you see an ophthalmologist and they'd be able to do all these different things to, kind of establish eye health and they'd be able to, kind of evaluate for everything like slit lamp, they'd be able to do tear breakup time, whatever. But now they're breaking the eye into literally I mean, it's almost like, I mean, it will move towards a situation where you have a cone specialist, a rod specialist, a ganglion specialist, and
Um,
none of them are working in harmony. There's no symphony there at all.
my partner was a retinal specialist, but in 1980, there were two pathologists that came to Harvard from Australia. Okay. The Sarks, Shirley, and I forget the name of the husband. This was like the early 1980s. Okay. And they were ocular pathologists that saw the connection between pathology and different disease states beyond the eye. And they presented at Harvard. And Charles Scapin, the father of modern retinal surgery, said to Dr. Tremp, do not mention the word inflammation, because that's not what eye doctors do. Inflammation's whole body. We're just looking at the eye. Glaucoma is a disease of pressure. So if the retinal nerve fiber layer is deteriorating, no big deal. We know it must be the pressure, right? But the pressure, what's causing it? So at the end of the Sark's lecture, Dr. Tremp, of course, said, so what you're saying, Dr. Sark, is that these eye conditions are really systemic inflammatory diseases. And she goes, Clem, weren't you listening for the last 2 hours? But the point he was making that to clarify the point to everybody else in the audience who completely ignored the thing. And this, they're just ignoring this fact that it's a systemic. So what causes macular disease, which is a vascular disease? What causes glaucoma, which is a neurodegenerative disease, which is really an ischemic disease that's affecting the nerves, happens to be in the eye. It's all vascular that's affecting the neurologic. So, chlamydia pneumoniae, we find that in the eye. Brian Balin has done the landmark work. Oral spirochetes, Judith McCloskey has shown that connection, Um, um, uh, it'll come to me, but he's out of UC Santa Barbara, showed that drusen is an amyloid, okay? Drusen, these little yellow globules in dry and wet AMD are amyloid, the same amyloid that shows up in the brain. So macular disease is actually it's a vascular and neurological neurodegenerative condition. They're all the same. Don Anderson at UC Santa Barbara. But, and then we go to Rudolph Tanzi, chair professor of neurology, that says the amyloids are antimicrobial peptides. So it's part of an immune defense. So what we have, then we go back to Charles Mayo more. Charles Mayo and Frank Billings, turn of the previous century, said that a lot of diseases are what I called chronic diseases are focal in nature. Acute diseases, like cold flu, you're sick all over. Focal diseases target a very specific tissue compartment or whatever. So you pull that all together and you realize that the eye is just a canary. That's all. I mean, obviously you have manifestations. Like I have retinal decay. 'Cause I have toxoplasma gondii. And, there's almost every optometrist or ophthalmologist, including my son, I just talked to him the other day, they know what toxoplasma gondii looks in the eye at late stage. It forms a scar, a very characteristic looking scar that they can see with a slit lamp microscope or ophthalmoscope. But then they look in your eye, they don't see a scar, they see retinal deterioration, they measure your pressure and they say, oh, it's a disease of pressure, take these drops. This is what we've got. This is what we've got, which symptomatic, symptomatic, symptomatic. So ICD 9, 1978, 18,000 diagnostic codes. ICD 10, 2017, 2015, 59,000 diagnostic codes. ICD 11, which is coming, 83,000 diagnostic codes. So what are they doing? They're making more and more subspecialties of subspecialties of subspecialties. Johns Hopkins perfected, I wouldn't say invented it, grand rounds, and that's what they did in medical school, just like we're doing tonight. Everybody here on the call has different expertises that they can contribute to the discussion. And when you go in isolation, I'm now going to go. I see, Dr. Gamble hasn't kicked me out of the program yet, but I'm just going to give you an example. Thomas Sowell, far as I'm concerned, the most brilliant social critic and economist on the planet. And I'll give you a very simple example of how this relates to medicine. He talks about cultures and the advancement of culture. And he talks about the Mississippi River in the United States and the Zaire River. Where does the Zaire River go? It doesn't go through, but it's in Africa, okay? But the Zaire River drops a mile and it's in stages and cascades and waterfalls and stuff. It's not navigable except for small sections. So what that did historically is it limited communication between peoples and cultures. So people along the Zaire were not as sophisticated in developing technology from the sharing of ideas as the people along the Mississippi. And that's what's happening in medicine too. We're basically creating what river did I say? I already forgot.
Zaire.
Zaire.
Is it the Zaire River? Yeah. So like we're becoming the Zaire River, not the Mississippi. That's a long lecture, that's a historical
So
view.
Carla has a question to ask about someone who's having eye surgery.
Yeah. Okay, docs. So one of the ladies, a friend of mine, so this, I'll read it. She said that her mom had cataract surgery
Yeah.
and it went well. She had when she before she got the second one, she didn't want to. She already felt easy. Anyway, unfortunately, the second one did not go well. She got a corneal abrasion somehow. She sees blurry out of that eye, and she's been back to the doctor many times, changing the regimen of eye drops, creams, and now she's even wearing a contact on that eye to protect it. So what do you think, Docs? What and to this day, so this was she sent me this was March 31st that she got it, right? And then I followed up with her to ask her, check on her, how her mom was doing. This is April 10th, well, it's gonna be 2 months. She said, my mom has not been doing well with the eye. I took her to a specialist. I did not get good news as the corneal abrasion is not healing properly. It may take weeks, months for her to get her vision back properly, if it even does come back properly. So they still continue with eye drops and oral meds.
So you're asking
Yeah.
what she can do?
Yeah. Is there anything
Okay,
like
Dr. Lewis,
what?
any
Yeah,
thoughts,
thank
Dr. Lewis?
you.
So cataract surgery is the number one surgery on the planet, but it's still only
Mm-hmm.
99% effective. So you have a 1% chance of something going wrong.
Wow.
Okay, it's just the way it is. I mean,
Yeah.
there's some, I don't know exactly what's going on, but some do no
Mm-hmm.
harm drops you can do rather than just their standard antioxidant drop that they use would be like N-acetyl carnosine
NAC.
drop.
Yeah.
How do you spell that, Dr.
N-acetyl
Lewis?
It's
carnosine.
NAC, but you have to make sure it's the N-acetyl carnosine, right? Not the cysteine.
Not the cysteine.
Yeah.
Iodine drop.
Oh, look,
Ah,
it has
Iodine
it. It
drops.
thank
has
you,
it.
Lo.
So,
Spotlight, Lo.
Can you put the
so,
link for that in the chat,
Yeah,
Lowell?
thank you. Yeah,
uh,
and I'll click on it and send it to Aunt
but I'll put a couple in too, but there's iodine
yeah,
drops in cases in
okay.
this part. So you go www.iodine.org. And then you
Mm-hmm.
go to look also for the DMSO store out of Canada. And it translated for me, DMSO store out of Canada.
Oh, okay. Oh, nice.
Get the DMSO 20% drops.
I
Okay.
don't think they can use DMSO though in cataracts because it's a
Oh, wait a minute. If they have an artificial lens, they can't use it. You're right. You're
yeah.
right.
Oh,
But the other thing is
look for a
the other
DM.
thing is
So don't do the DMSO. So
Okay.
scratch that.
Okay,
Pretend
scratch
as if
that
you
out.
didn't hear it.
thank you,
Okay.
Laura. Thank you. 100%.
Because of the
But,
contacts, right?
but the other thing
Because
is
of the lenses from the cat, yeah, from the
I'll
surgery.
go extreme here, but
Okay.
urotherapy, you want to get some stem cells in the eye.
Mhm.
Okay.
Mm.
Stem cells any way you can.
Urotherapy.
And
Are
urine,
you aware of
Yeah.
what urotherapy is,
Is that the
Carla?
urine?
Yes.
And
Okay.
can I tell as well, like be very careful of inactive ingredients in all these eye drops. They're putting in
Yeah, they've been
absorbing,
recalling stuff.
yeah,
Mm-hmm.
they're putting polyethylene glycol, all these different like in all
Thank you,
these
Lo.
yeah.
prescriptions. So they're very harmful. Like, I mean, they really do damage to your immune system. So, and they seem to be in everything, polysorbate 80 and all these preservatives.
Yes.
I think that, you know,
Thank you so much,
Oh,
Doc. Thank
the
you,
other
Lo.
thing is we had
Wow.
Andy Rosenfarb on last night that does the microcurrent therapy and he does
oh,
red
the
light
infrared,
therapy.
yeah.
And that was a really good lecture. But he also said, now Ron Neer is someone that I think it's on Amazon. There are MSM drops. And
Mm,
what he says, MSM, this is Andrew Rosenfarb about the eye, and he's been a holistic eye practitioner for 20 years. He says MSM solution is like taking internally and topically in
mm.
the eye. He calls it the in the laundry analogy is it's
Detergent.
the softener that may help. So those are three different drops. I want to see if I can find
So
uh,
in the chat,
Thank you.
Carla, there's the one that
Yeah.
Lowell put in there
Yes, the
for the
Can-C
Can-C
drops.
drops.
Okay, great. Yeah.
Okay.
I wrote that down and I'll
With
send that.
N-acetyl carnosine.
so
Okay.
I don't know why this is so expensive, but at least this is from Kate Minimalist, who obviously doesn't believe in minimalist pricing. But you can look at what this is. You can look at what this is and what it is.
Okay, I'm gonna click on
It's
that.
it's
Okay.
liquid MSM drops, but I think you can find this on Amazon much
Mm-hmm.
less expensively. And
Okay.
to go look on Amazon, Ron Neer is a good friend and colleague of mine who has this what he calls the gold standard MSM crystals you can take internally. Sulfur is an
Okay.
extremely important thing in the rebuilding of tissue. Every See, like
Sulfur.
proteins are little straight strings, but proteins in a
Mm-hmm.
functional form fold, and it's the sulfur that makes them fold. And when they fold, they become active. Otherwise, they're just like, I'm trying to think of an analogy, but like it's a piece of rubber lying flat versus a tire,
Yeah.
that
Thank you.
that kind of thing.
That'd be
Then
helpful. Yeah.
the other one that I like to share with people is Eye Bright. It's with Dr. Schultz. It's an
Oh,
herbal
yes, you gave me
formulation,
some.
and it helps with improving circulation because part of the healing is making sure that you have optimal circulation if you don't have proper circulation, then the body is not able to heal as effectively. And a lot of times, especially with people that we're talking about, their circulation is not too great.
The
So
Dr. Jean Rosoff as well talks about Demodex, especially in people over 50. Like, I mean, everybody has Demodex infection, but I think then when you go for surgery, there's no kind of preoperative management. You're just kind of thrown into it, and then your eye goes through all the trauma, and then on top of that, you have this kind of opportunistic bug, the Demodex mite. So that's kind of like the iodine is very, I think very, very helpful. No harm to get his rollers. Like I use them all the time. I think they're great, and I do the iodine drops as well.
So Maura is bringing up a really important point, that perhaps part of the reason why she's not healing is maybe there is an infection, an opportunistic issue, a viral infection that may be underneath the surface. And so that's where,
okay.
you can contact, say, Dr. Lewis to get the proper
Okay.
testing done.
That's
to see
why
if that's a
a
possibility.
starting point would get those iodine drops. That could potentially.
Yeah, so
That's
so
not
how should
that's
it,
not
so
the end
use the
all be all.
iodine? Okay.
Those
So
iodine drops, just do them once a day. Just
mhm,
just like, I mean, I do the DMSO, the
yeah,
N-acetylcarnitine, and the iodine drops every day. I don't do them at the same time.
But
right.
do not do the
I
DMSO in this
won't. Yeah, I
case.
scratched
Okay.
it.
And another thing as well that he brought up yesterday was the castor oil.
I did.
People, but it kind of repairs the lipid layer.
Oh, what's that, Mara?
The
You
castor
said
oil.
yes,
Absolutely.
yes.
Yeah, but some of it can be a little bit too thick, but you can actually cut it. But you need a good quality, like kind of an avocado.
I cut it in DMSO.
I
Just
know.
kidding.
Oh,
Just
Dr.
kidding,
I
Ed would say,
Michelle.
do that. You.
I bet you do. Yeah, but
Oh.
he doesn't have the lenses in his eye. But she could cut it with a bit of avocado, but really
Dr.
good
Lewis is
quality
being
avocado.
naughty today.
Thank you, Lowell, for that recommendation too. Yeah.
Yes, thank you so much. So the thing is that should she use one? Can she use like is it one she should use, or can she use like
I'd use all of them.
few different, use all of them,
I'll-
right? Yeah,
I'll-
because you never know. Yeah.
Well, you need
Okay.
the iodine. I mean, number one, like
Yes.
she's washing her face in chlorine water or whatever. So I don't know what she's using to clean her oil. I'd be really careful using any of the oils. There's hydrochlorous or is it hydro or hypochlorous acid you can get.
Hypochlorous.
Yeah. So then
So it's actually an eye
Oh,
like eye
rinse.
drop rinse and things like that. You can get that. I
Mhm.
forget what
Yeah,
it's called, but you can get that at CVS. Yeah,
there's
hypochlorous.
a good
Ah,
one actually you can get without
hypochlorous.
harmful kind of inactive ingredients. I'll send you the link, Carla.
It'll be like
Yeah,
an
thank
eye
you.
flush to
Yeah,
just flush
but
Yes,
the eye.
nice.
so it's good.
Okay.
And then I would use the
She'll
oil, I would
appreciate
use the
that.
iodine, I would use the and Dr. Rosoff, he does it in the little rollers. So he gives you 10 milliliters, and then you have
Oh,
iodine.
Cardio Miracle. Yes, Lo.
Yeah.
Yes.
But anyway, the rollers are really helpful. And you can put castor oil in a roller bottle and then roll
Yes.
that on your eyes, especially before you go to bed.
Mm-hmm.
But
Oh,
I
you
think
said like
infrared
over
helps.
this, like that,
Like,
right?
yeah, just here. Yeah.
Yeah,
And as
yeah,
you sleep,
nice.
it'll absorb
Okay.
in.
Yeah.
Okay.
And they're
Okay,
handy.
so
Like, I mean, you can just carry them in your pocketbook or wherever, so you're not going to forget them.
exactly. That's nice. Roll over the eyelids before bedtime.
Mhm.
Or you can use it as many times a day.
Anytime you need to, right? Yeah.
Yeah.
Okay.
Absolutely, yeah.
Throughout the day. Okay. Right. Because castor is not.
Yeah.
Thank
But
you,
remember, a
everyone.
good quality castor oil, not some of the junk
Yeah.
that
What's
you
a good one? Oh, Dr. M, you gave it to us. We have it in our resources, right?
Yeah,
I think you
Queen
showed
of
us.
Thrones is a good one.
Yeah, Queen of
Yeah.
Thrones is
Queen
the
of
one
And
that I
there's another
use.
one as well.
Organic, very good.
Yeah.
Mm-hmm.
Okay.
All right. Throughout the day. This is great.
Cool.
Thank you all.
I have a
Well,
question.
it was a
Applause for
group
always.
effort. I love it. You guys are so awesome together.
And thank you, Mara, for sparking that eye conversation, because I kept meaning to bring it and I was so worried about her mom. It's
Yeah.
like when you have these you know, compared to someone that's not born with it, but when you have this and then you have to, when it's impaired, I know it could be so
Very,
frustrating.
very scary.
Yeah,
You know,
yeah. And
But
to
there's
know
one
that
thing
her gut was telling her she didn't feel good about the
she
second one.
about
you
doing
need
it.
to get off seed oils as well. Like, I mean, zero seed oils in any form in her diet. They need to be eliminated.
Okay, yeah. Okay, so
Yeah.
Mara, you said any seed oils in her diet needs to be eliminated?
Totally, 100% off them. She can't have
Okay.
any of them.
So, you know, one of the things that I love about what you just shared with us, Carla, is that aspect of following your spirit. You know, if
Yes.
something doesn't sit right with you, to
Oh,
just say, you
yeah.
know what, I'm gonna hold off on this.
Yes. Oh, Dr.
Because
M.
who knows?
Yes.
Maybe it is that she could sense that her immune system was
Yeah.
down or something of that
Yeah.
nature. So I'm not
Yeah.
saying that she shouldn't have the second surgery. I'm saying that at that point
Right.
something told her, you know,
Yes.
maybe I should just hold off on this until later, you know.
Right.
So what I want to encourage everyone to do is to really have the courage to listen to that inner voice. And sometimes we may
True.
not be able to say, oh, it's because of this, or it's because of this
Right.
study or that
Right.
study. But if something within you is saying, pump the brakes, unless it's like
Listen.
major urgency, and in most cases, it's not major urgency where you have to do XYZ procedure right then and there.
Yeah.
So if
Yeah.
you ever have that sense of inner wisdom, to have the courage to go along with it, and I guarantee you that something somewhere down the line will give you that awareness of why you were told to
Yes.
hold off,
I
you know?
know.
But a lot of times we're being pressured by medical professionals to do something in that very moment. Like, oh my God, you're going
Dr.
to die if you
M.
don't do it right now,
My
you know?
story. Yes.
Yeah. So that is why we come together. And you know, you can come together in this forum and ask the questions, and then you can go back and have that conversation with your
Thank
provider
you,
with a little
Ma.
bit more
Yes.
army of information, right? So
Mm-hmm.
once again, ladies and gents, Dr. Lewis, any parting words?
Oh, that was the shortest one I've ever been on.
I can just
Dr. Lewis, get well. Oh, you got
I'm
me feeling
fine.
so
I am fine.
sleepy.
Thank you so much.
Oh,
It's all
before
good.
you
We're
go,
All
before
we're
you
good.
go, Dr.
sending you
Lewis,
our prayers
How did your
to
how
yes.
did
help
your
your
bike come through the fall?
You know, I protected it with my shoulder, lol,
Uh-huh.
but I couldn't afford the bike cost more than the surgery.
whoa,
A
that's
dubious
scary.
choice.
Way more. Anyway.
All righty, ladies and gents. So until next month, thank you, everyone. And be sure to send in your
Thank you,
questions. We
Doc.
look forward to being able to be in community with you, to learn from you, and to share and serve you however we can. Until next
Uh,
time.
Dr.
Till
thank
next
Michelle,
you.
time. Have a
Yes,
great
yes.
weekend.
can
Oh,
you hang
Oh,
for just a second? I have one quick question for you.
sure.
So, I have some of these little liver spots that are starting to show up, and we just
oh,
did a great cleanse, a liver cleanse.
Mhm,
I've been putting DSMO on them, and they're fading. Do
mhm.
you think that since we did the liver cleanse, will they kind of fade on their own, or?
Well, it may have started the process of helping you to clear out the liver. Also, are you
mm,
doing any like vitamin A?
Yes.
Okay.
mm.
Mm. Any other thoughts, Dr. Lewis?
You know, Lowell, I don't have your labs in front of me, but these advanced glycation products, go get your
The
sugars down.
AGEs.
What's that?
Yeah.
The AGEs, yeah. So
Yeah,
he's working on his blood glucose
yeah,
stuff.
good. Yeah. And other than
Mm.
that, I'm not quite sure. I think what you heard is probably the best suggestion. I can't offer one better than what I heard. Yeah. But I
So
love
I've
the
got,
castor oil, love the tea tree oil.
Mm-hmm.
Work on inflammation, work on the sugars, the
yep.
advanced glycation products. Yeah. Get some sunshine,
Yes.
castor oil, tea tree oil, things like that.
And
Yes.
the
Nice.
cod liver, because the cod liver
Yes.
will have the combination of the A and D.
Of course. Yeah.
So yeah,
Mm-hmm.
yeah.
and I've got a cream that's 10% DSMO. It's an arnica cream with 10% DSMO, and then I've got a DSMO roll-on that's 99% DSMO.
Dimethyl sulfoxide, but so it's DMSO,
DMSO,
and
yeah.
be careful with the 99%. It can be
Mm,
irritating to your skin.
mm.
It can be a little bit. What I do is I roll a little bit of that on because that's a solvent, and then I put the cream on top of it, and I think that helps to suck it in.
It
You
might,
know,
yeah. It
yeah.
Nice.
And they're fading. I guess I just can't expect them to go in a
Mm.
week, but
But
No,
remember
that's
that we also want to look at it from the inside out,
sure.
right?
Yes.
That's the
Yes.
cod
So
liver oil.
yeah, the cod liver
Mm-hmm.
oil and
Nice.
the AGE or the advanced
How
glycation
we
end
used to take
products.
that, Tom? We did some at bedtime. Didn't you do like a tablespoon of cod liver oil?
oh, I always do a tablespoon of cod
Just
liver
slug
oil
it
at
down, or
bedtime.
do you mix it with?
No, I just
Mm-hmm.
do it straight up. I just do it
Okay.
straight up, and I'll chase it with a little piece,
Some lemon.
a little
Oh,
piece of
that's what
citrus.
Yeah,
mom used to
lemon
do.
or
Ah,
orange.
Yeah,
Yeah, that
but
will help.
Lowell,
That'll help it go down.
yes.
I'm not as fussy as the ladies are
Not a
about.
spoonful of sugar. Not that.
No, but with their castor oil, I just get an organic castor oil, and
Yes.
my castor oil, I try to take as much as I can, and the way I do it is I use it as well, I don't want to say quite cooking oil, but it's on my cabinet right above my stove, and at the end of a stir fry or whatever, I'll just sprinkle
Scribble
some
it in.
castor oil in. I will even put castor oil at the end of cooking some eggs, like some,
Mhm.
Oh,
scrambled
nice.
eggs or
That's
things like that.
cool. That's a
No,
good
because
idea,
No, the
David.
best thing with the eggs is to use
Wow.
the cod livers. If when you scramble the cod livers in with the eggs, mwah,
Mm.
delicious.
that's good. I put cod livers in stir fry, but see
Cooking class too.
the castor oil has no flavor.
Lovely. Yeah.
It's just its viscosity. Like I'll even make, I mean, I don't recommend raw vegetables for most people, but if you do a salad
Mhm.
like I do occasionally, I
Make
just
a
use
salad
olive
dressing.
oil, balsamic vinaigrette, and then I'll just
Mhm.
drizzle some castor oil on that too.
Nice.
I am trying to
Okay.
get as much castor oil into my body because I tell you why, when I the last couple of years I had like 4 90-year-olds, and they were usually brought in with a daughter. And all four of them, when they were young, either were force-fed cod liver oil or castor oil. Okay.
Wow.
And these 90-year-olds were all healthy. The daughters bring them on. Oh, I'm worried about my mom. And it's like, wait a minute. She's
Be
healthier than
worried
you
about
are,
you.
Missy. She's healthier than you are, Missy.
Exactly.
Go
So
moms.
hopefully that helps, Lo.
Yes, thank you very
Yay.
All
much.
That was
right.
great. Yeah, that helped me. That was some great
Awesome.
stuff.
There we go.
Sophie.
All
Look,
All
right.
righty,
Sophie's
You
like,
guys are
okay,
too
it's
ladies.
fun.
Next
time. I
week.
need my
Bye.
mom.
So until next month, and also remember we have our weekly ABC clinics every
Oh,
Wednesday
yeah.
at 10 Central. So if you have any questions that come up that pertain to assess, build, or cleansing the body, be sure to log on during that time to get any assistance that you may need. All righty,
All right. Thanks
later,
again.
Gators.
Take
Bye
Thank
now.
care.
you.